evening. We're now calling this meeting to order. In order to do so, I need to determine a quorum. It looks like all of us are here except for one, and I don't believe Ms. Burns is calling in tonight. So at this time, we can call this meeting to order. We need to stand for the Pledge of Allegiance, please. Reverend Smith, please.
Yes. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. At this time, we need to approve the agenda as presented. Is there any changes that need to be made?
I'd like to make a motion that we amend the agenda to include an information item on a school name presented by Mr. Keith.
Okay. Mr. Hall has made the motion. Do we have a second?
I'll second.
Mr. George is seconded. All in favor, say aye.
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 Any opposed? So moved. So we will move that down. You said under information, is that correct?
Yeah.
So we'll move that to item 7.4. Okay. All right, so since that's been done, do we have anything else that needs to be amended?
I'll make a motion then to approve the agenda with the, as presented now.
All right, Reverend Smith has made the motion. Do we have a second?
Second.
Mr. Hall seconded. All in favor, say aye.
Aye.
Any opposed? So moved. At this time, Dr. Hill, we're moving into the recognitions part of our program.
Yes, ma'am. Tonight we have two students with us from Topsail High School. I'd like to welcome up front Brendan Lyons and Caitlin Shepard. They're back there in the back. So Brendan and Caitlin were recently selected as semifinalists for the National Merit Scholarship Program. Of the almost 1.6 million students who take the PSAT or NSSUT every year, only about 50,000 score well enough to be considered for National Merit Scholarship. And only 1/3 of those will be named as semifinalists. The list will be narrowed down to finalists in February with approximately 7,600 students from around the country. We are now in the semifinalist round, correct? So we are getting close. Eventually being selected as the National Merit Scholar. Congratulations, Caitlin. Congratulations, Brendan. You guys ought to be very proud of you.
You want us to?
Stand behind y'all.
Yep.
That's right. You guys turn. There you go. Where's the-
On turn right.
One more.
One more. Yeah,
You know one? Yep. We can email them to you.
Thank you. Congratulations.
all right. Thank you. Good job, you guys.
We'll have you back in March, right?
Yeah.
We was all the awards tonight.
All right, well, that's all for our recognitions tonight. At this time, we're now moving into public comments. We do not have anyone who is here to speak, but we do have 2 call-ins, okay?
First message is from Diane Capron.
Diane Capron, public comment at October 12th, 2021 board meeting. Board members, I applaud you for instituting free in-school COVID testing and appreciate that you're taking action to protect students. I am, however, disappointed by your premature return to a mask optional policy. I ask you to adopt universal masking at least until all students have the chance to become fully vaccinated, and this is why. Students under the age of 12 are completely vulnerable, especially when other layered protections like opening windows, room air purifiers, and 3 feet of distancing don't exist in classrooms or cafeterias. Currently, 25% of COVID patients are children, and 20% of those pediatric cases go into ICU. This virus is dangerous. I have sent numerous studies and data for your review that show how optional masking offers little protection and makes a virus outbreak 3.5 times more likely, how universal masking is effective in slowing virus spread, how there are no adverse health effects, how it ensures uninterrupted in-person education by preventing healthy children and teachers from being subject to quarantine. Your mask optional policy contradicts our governor's recommendations for schools, as well as the recommendations of health experts at the CDC, North Carolina Department of Health and Human Services, North Carolina Strong Schools Toolkit, and the American Academy of Pediatrics. Medical professionals are experts regarding the health of our students, while you are experts in the education of our students. We can all agree that our goal is to keep as many children healthy and in school as possible. A mask optional policy does not support this goal. As you know, the mission of the North Carolina State Board of Education is, quote, to guard and maintain the right of a sound basic education for every child. And the mission of the Pender School Board is, quote, to secure and organize resources for ensuring the delivery of services in a manner that prepares all students to compete globally. It sounds really nice to give parents a choice, but a mask optional policy actually undercuts your educational mission when it threatens the health of more students than necessary and results in even more students being excluded from their in-person education. It also conflicts with your code of ethics, which is, quote, to make policy decisions while always keeping in mind the objective of providing students the opportunity to receive a sound basic education. In no way is the choice personal when it has a negative effect on the health, safety, and education of others. When an unmasked child exposes another child, the healthy masked child is still subject to quarantine and testing and is forcibly excluded from school. Therefore, your policy allows one parent to make a choice that takes away another child's civil right to their education as well as threatens their health. I urge you to follow the compelling data that proves universal masking supports your mission statement, increases students' time in school, reduces virus outbreaks, and makes
The next message is from Michael O'Brien.
Yes, this is in regards to Mr. Pearsall's suspension. You guys, the Board of Education needs to understand that you are taking away all the good teachers in Pender County with your overly aggressive, far-right stance against teachers. His assignment had nothing to do with promoting ideas amongst kids. It was optional, and it just asked them if they figured out where they fell on the spectrum. Heaven forbid teachers or students should actually think and use their brain. You have now taken a teacher who teaches a college-level course, AP US History, and taken him out of the school when he is needed there to teach those students. A substitute teacher is not the same qualifications. Stop sticking your head where it doesn't belong. This board needs to stop being political and actually do what's best for the school system. Thank you.
All right, that is it for public comment section. We're now moving on into the information agenda. At this time, we're looking at district COVID-19 protocols process.
I'm trying to bring up Thank you, Madam Chair, members of the board. I've got Shirley Steele and Carolyn Mosier from the Health Department online, and we can actually start with their data. That is the first slide. So, Carolyn or Shirley, would you care to speak to that, or would you just prefer that I talk to it?
Well, if you're referencing a slide, I don't have that, so,
That's the weekly update directly from your website. And so the total COVID cases.
correct, okay. I'll just go ahead and, cover my information as of today, and, then what exactly we're seeing with the school system right now. We have been really fortunate in Pender County to see a decrease in our COVID case numbers. And I'm thrilled to see that. We're starting to see quite a few individuals change their mind to be vaccinated. And then we've had several people that are seeking the boosters. Right now, of course, it's just the Pfizer booster, but Moderna should be approved sometime next week, or maybe this week, according to my understanding. Right now, as of today, Pender County's positivity rate is 8.6%. The state is 7.7%. This is the lowest we've been since probably June, which is good news to all of us. It certainly, in turn, impacts a lot of what's going on in the schools. As I looked at the school information, it looks to me like the week prior to optional mask, which was the week of 9/27, you were averaging 1 case and 2.4 exposures. What's happened now is you've doubled that. For every case that this week of 10/4, for every case that you had in the schools, you had 4.4 exposures. And this is not surprising. Needless to say, I think we had mentioned that this would happen if you went to optional mask, that we would have to exclude more from the schools. The health department is looking at moving toward more testing and rapid testing. I understand that you all are pursuing some rapid testing possibly, so that those individuals that have been excluded from schools due to an exposure, if they are asymptomatic, they could get tested on day 5 and possibly return to school on day 8. But other than that, I don't have anything else really to share with you, except that the more cases, the more exposures are having to be sent home.
Thank you, Ms. Mosier. Any questions for any board members? Any questions right now? I just have a couple of questions. A parent had sent out an email to me, and I forwarded it on. Ms. Steele, are you on the line?
Yes, I am.
Okay, just a couple of questions, because I know the other day when we had a meeting, you mentioned real quick how the CDC had changed some things regarding possibilities of quarantines, and we're just waiting to see if the state was going to update our toolkit to show that. But just to reiterate for everyone, I know there's a lot of questions out there about antibodies. Can you tell us, you or Ms. Mosier, whoever, about the antibodies and what that means for quarantines?
can speak to that.
Okay.
So according to the Strong Schools Toolkit, antibody testing can be used as a means to exclude a kid or someone from quarantine. So Ms. Mosier and I have discussed this, and we both really want to adhere to the Strong Schools Toolkit as much as possible. And so we are going to follow that guidance until it is removed. The Strong Schools Toolkit was updated on October the 5th, and it still included that. The CDC did take that guidance down, and I know that the state is currently looking at that, but right now it is still in the toolkit, and we are still going to follow that guidance. And it is a case-by-case basis. Parents just need to, submit that antibody test to their school nurse, and they'll get it to us, and then we can make a determination just to make sure it's falling in the therapeutic range. Is what we're looking at.
Okay, and that's the same also if they've had COVID. They just have to show, and I'm looking at Dr. Blumenright as I speak to you and to him. So are we showing that? We show the results, like the positive results, to the school in order to go back to the school. And is the nurse keeping up with that? Because isn't it also in the toolkit that they do not have to quarantine if they have had COVID within the last 90 days? Am I correct? Okay. Dr. Blumenright's nodding his head, so I guess we're good. I just want to make sure that everyone's out there watching or listening is understanding that, because I think that's pretty crucial information for everyone to know. I think it kind of gets muddy. The waters get kind of muddy with that, so. All right. Thank you. I don't think there's anything else for the health department from me on that. Just where are we with testing? I know the company.
Okay, so that's everything's in process. So of course the board approved it on Thursday. We were immediately able to kind of get everything in, get the sites registered, all of that, or get the process rolling for all the sites. So that was a pretty quick turnaround. So by the close of the business day on Thursday, we were logged, and now there's a couple different processes occurring. So each site has to be a registered site. People have to be trained. We're looking at a couple of hiring options for nurses predicated on our CFO getting back as soon as possible. We're also applying for funding through DHHS. So there's kind of multiple balls in play, but we're moving as quickly as we possibly can. So we are looking forward to getting those testing options online as quickly as possible. So.
Board members?
Thank you for your work.
Mr. Hall, you good? Mr. George? All right, we're good.
I just wanted to let the public know that this is updated on a weekly basis, as you can see, with the confirmed positives and the currently excluded. And it's a rolling weekly. So as the next week comes on, then the last week will drop off because there's only just so much time. But it does give us a good kind of viewpoint as far as trend lines and things like that regarding positives and excluded. And for the public that is interested, this chart you will find updated every Monday on the front landing page, and you will see Pender County Schools COVID-19 dashboard. You click right there, we'll bring it right up. So.
Yeah, I noticed that the other day. That's pretty awesome.
So.
All right.
Questions?
Nothing? All right, thank you.
Yes, ma'am.
All right, next item under information, 2021 PCS state assessment results.
Good evening. So I did not present last year because we didn't have any data from the previous year. So we do have some from this past school year, and it is just going to look different, obviously. So just a reference in, we've always talked about accountability measures versus reporting measures. So accountability measures are our school performance grades, our identifications, all of that. So that was waived for 2021, and we're just going to talk about the reporting numbers for the data that we have. Sorry. I'm not very good with this little keyboard thing here. So here's just a comparison from 18-19 to 2021. They've really, and I did miss one part. For the reporting, DPI has stated very specifically, and they repeat this in every webinar that we attend and all the trainings, is that this is really we're supposed to use this data as a way for us to make instructional decisions for planning for this school year in the future. So they want us to remember that this is not an accountability measure and to not use these as evaluation tools. So basically, a lot of people are saying that this is a starting point for us to move forward. So on this, I've just compared EOGs and EOCs and then combined them together. And you can see, obviously, that we do have a drop in the scores overall from the last time we tested. Some high school indicators are the cohort graduation rates. We continue to stay pretty consistent with that. Our record keeping is the big help with that, because as long as we can track our students that leave after they have entered 9th grade, then we are able to keep our numbers pretty consistent with that. Our ACT proficiency and work keys proficiency, they actually saw a bit of an increase, especially the ACT. And again, that was just the percentage of students that we were actually able to test, because not everybody tested. But for participation, I am very proud to say, even though we had a lot of virtual students, our schools worked extremely hard to make plans for students to come in and test either one-to-one or in small groups. During school, after school had started, we had some students come in so they didn't have to be in contact with any students. We had some that tested after school. We used the virtual Wednesdays quite frequently. And the 18-19 year, all of our schools were above 95% participation, and our LEA was as well. And considering the situation we were in last year, we had 12 schools last year above 95%, and the other 4 schools were still above 90%. And our LEA was still over 95%, so I think that that is really good for the situation that we were in. Our EL progress, we were able to test our EL students, and out of 419 that were tested, 99 of them either met progress or exited, and that's based off of their access scores from the previous year. And we were able to test them in 1920. That ended right before we went on lockdown. And then I have a comparison of us with the state and the other districts in our region. And so the top row is for North Carolina, and then we're next. We did, in the overall indicators, score higher than the state did, and then you can see where we stand in comparison with the other LEAs. And Dr. Blumenreich, have you already passed them out?
Yes, ma'am.
Okay, so you have a folder, and I've just printed out some various charts that I had created for the schools and for district leadership. So there is just Pender County schools with the overall indicators. Then I have a breakdown where I have put information for each school level, elementary, middle, and high. For the high school, I did include their other indicators as well. You have a printout of the breakdown for the EL progress by school, and a copy of the Southeast region chart. And then there's lots of other charts and data that I have if you're wanting something else in particular. And that is all. Any questions?
I will take inclusive of the board. I mean, there's two metrics. There's an overall metric, like you see everything across the board, reporting board. We still are ranking about number 11 in the state there. And we've actually, if you only look at grade level proficiency, we actually moved up a couple of steps. We're now 25th and 27th. So even though the numbers aren't great, obviously they're not great across the state, and we've actually improved in ranking.
Thank you.
Well, and I think just as a comment, to put things in perspective, hadn't really thought about it till, I think we talked about it about a month ago. And I have a 3rd grader, and if you think about it, our 3rd graders this year have not had one complete year. Let's look at that. Kindergarten was Florence. first grade was the spring when we shut down for COVID. And then last year, the schedule, it was all over the place. And then this year, and we still have COVID going on. So if you think about it, our babies haven't had, the third graders have not had one complete year. And that's even third on, that's just, it's eye-opening. Makes you think about, I'm impressed with how well they have done considering all these years through all this, so.
The test data, especially what you have in your packets, really needs to be used with a lot of discretion. Because it may or may not be applicable, especially considering the number of years that the students haven't had as full cohorts testing processes due to full instructional delivery. So, it's one of those things.
Thank you, good information. All right, at this time, we're gonna look at staff lunch information.
Madam Chair, members of the board, what you have is a small packet kind of coming around, and just to kind of talk through it, there was a request to look at basically how much it would cost to have our staff eat lunch. And so given there's a lot of variables in the mix and participation could vary widely, the best way to generate a number would be to come up with a range. So the first month that we have full data for adult a la carte and meal sales would be the month of September. And so those are your first 2 pages, and that's pulled directly out of the Titan, the consolidated sales software. And at the very back, you've got, of course, the a la carte and just some pricing there for you. So in that third page, you have the set of calculations that goes into kind of generating an idea of what things can look like. So for the month of September, with a la carte sales, we had just a little bit under $1,000 worth of adult sales. And then with full adult meals, a little bit under $1,500 a month. Multiply that out by month, and looking at if everything stays equal, not knowing the number of adults that participated, we would be looking at just a little bit under $30,000 a year. Now, that's the low end of the range. In talking this through with Aramark and Child Nutrition, Dr. Hill and a few others, we all believe that if lunch is offered free to adults, there would be a higher rate of participation. So the high end that we would come up with is that a proposed price for a full adult meal, which we don't currently have, but they would institute, Aramark would institute something like that, or would think about it as a proposal, would be approximately $4 for an adult meal. We take that with 1,023.44 full-time employees on staff, and so that's not just certified teachers, it's administrators, it's maintenance staff, it's our nurses, it's just the whole gamut of full-time employees we have. And then with approximately 145 school days left, just multiplying that out, we would be looking at just under $600,000. So a lot of it depends on the participation. A lot of it depends on what is offered. We can have a wide range of prices. And the pricing, of course, for the adult meals can affect that. So kind of a wide bar from end to end.
How many meals would you say for one day? I mean, if everyone participated, which I know most probably everyone wouldn't participate, but if everyone did participate in just one day.
If everyone did participate in one day, we'd be looking at approximately, with the proposed price, $4 per meal, at approximately $4,093 for the day.
Has the district ever done anything, like a teacher appreciation day where they did say, well, maybe one day we pick a day that meal was covered?
That's a good question. I can't answer that, but I can find out for you.
Only PTAs are the ones that pick that up, or the funding sources. I don't know if there's been a time where the school system paid for mass feeding. I remember.
Not what I remember, not since I've been here.
What funding comes out of the, when we have the preschool, before school starts back, when they have the big rally and they have a meal and they give out little, trinkets to the staff, when they had it at Heidi Trask about 2 years ago,
Most of the local funds, I'm thinking.
That's preschool.
no, not preschool, I mean, before school started, it was the,
Oh, preschool, I'm sorry.
Convocation.
convocation, when we had convocation, what funds pay for that?
I think those are mostly local funds. I would need to verify with Betsy, but I'm pretty sure that that's what it would be.
Yeah, we fight to spend a couple of $1,000s is a big deal to spend on that stuff.
The only reason I was asking that, since we didn't have that event this year, if we were to do the, a one-day appreciation meal, we're saying, hey, you can stop in the cafeteria, pick up a free meal,
Like around payday.
something that just would be we appreciate what you're doing, even if they didn't participate in it, but since they didn't get we didn't have that event this year, then whatever money we had, maybe that could be a few dollars that we can use for that. Because I think that we probably all agree we don't have $593,000 extra, but if we could at least have one day, maybe. I'm not making that amend the agenda or anything, but I'm just saying maybe we could come back with some information next month with that.
We need our business somebody that's vital to this conversation. She would answer those questions quickly. And she will be back at the next board meeting. She's had some family situations. She had a family member pass away.
So basically, what I'm hearing Mr. Smith say is that maybe if we could look at it next month, what it would look like for one day a month. Is that correct?
Just one day, yeah, between now and pick a day one day between now and the time school gets out. We just pick one day that we call it, staff appreciation. And even maybe we get some, Dr. Hill to go up to, Topsail behind the food line and serve food, put a hairnet on, and have you go up to, Pender High, and Dr. Aiken go up to, Heidi Trask, and maybe Miss Fontana go to
Absolutely.
to one of the schools.
That's not a big leap for her.
That.
But and maybe they could see some of the folks, like Dr. Moore and others, even Mr. LaFond, get up, be in the cafeteria and help with the serving, and just make a fun day out of it for the folks. If we plan ahead and just really, advertise it, who knows, it could be just a fun event.
I pay money to see Mr. LaFond in a hairnet.
Oh, yes.
I was about to say,
But I just think it would be just something that would be a positive, just something positive. It seems with so much negative that we hear, if we could just do something positive, even something small like this, would be a good gesture to the folks. And I know if you pick a day, I know Mr. Hall, I would think and I don't know Mr. George's schedule, but maybe all of us could, pick, if we could do it, then we probably would do it.
If we could, I would definitely love to see all full-time employees be able to participate, not just, teachers in the building, maintenance staff.
Oh, that's what I mean, just, especially just saying one day, come in and do that, so.
Absolutely.
Okay.
Sounds good. So next month, you're good to bring that back? Are you guys okay with looking at that further? All
you
right.
can get an idea though based on the day, right? If you did $4,000 bucks,
Absolutely.
so I would, if you want to say today, it's probably under $5,000, I at it or something. But we could talk to Jen.
I'd feel more comfortable with, Miss Chestnut when she's here, and just knowing that what we spent on those events and just seeing if this is something, if the board wants to do it. I'm not trying to push it, but I'm just saying, I'm the one who requested, this to come before the board and, just as information. So, who knows? I mean, because right here, some of your statistics or data that shows that Pender Lee School, if I'm reading this right, no one purchased a lunch.
During the month of September.
So during the month of September, we had no one purchased a lunch at Pender Lee. Then you had at Pender Early College, $1.75 spent. Cape Fear Elementary School, no one purchased a lunch. And the one thing that this board really has tried to push is to the improvement of school lunches. And who knows, it might be, I don't know, maybe Airmark would, if they really believe in their product, who knows if we talk to them that they might say, you know what, we'll cut you a price, give you the price of a student's lunch. Or maybe they'll even eat the bill just to get the people to try the food. Who knows? And like a sample, when you go to a food court in the mall and they try a little sample, well, most of the time, what do? You feel like, okay, I need to buy something. And maybe maybe Airmark would do that. So I'm not sure. So whoever you'd like to talk to twist her arm in doing it, maybe.
We'll have to first talk with Betsy.
That's fine. Thank you. I don't have anything else. I know I didn't mean to put you on the spot.
Thank you. All right, and since we amended the agenda, we've now moved to 7.4. I guess Mr. Keith, we want him to come up and speak. Come on, Mr. Keith, you know how to do this.
Say good evening to everybody. It's mighty quiet in here. Y'all got it for a school board. It's mighty, mighty quiet. Everybody else is catching it.
Don't talk it up.
But I'm here actually. A while back, I was approached by a group of citizens from Hampstead in reference to the Annandale School, which prior to integration, Tops Elementary was Annandale. This is a subject that everybody get off of edgy when you start talking about segregation and integration and things that happen, but I mean, it happened. The school kind of fits that format of the Rosenwald schools, which that's what I started in Pender County. The school over in King Tuck is one of the Rosenwald schools. This past week, I was called to Pender High by a young lady who's doing her research trying to get into UNC Chapel Hill. She's doing the research on Rosenwald School, so she wanted to interview me. Surprisingly, I got there. It's a white female in a wheelchair. She got hit by a car, I think, when she was 8 or 9 years old, and she's crippled. But and I was really surprised. She had about 20 good questions that she asked, and she knew about all the stuff that's going on. But I think they told me they presented the petition at first to Mr. George, but apparently they didn't hear anything back from him, so they just asked me to follow up on it, find out what was going on. What they want is for some recognition to go back to the fact that it was there, it was Annandale. I think with the Rosenwald schools, the community raised part of the money, and then the county would give part of the money. And if that was the case, which I'm pretty sure it was with the school, what they're asking you all to do is kind of correct. When integration took place, I think 68, 69, I was in Bladen County. I started in Pender, but I moved over to Bladen. And a lot of things that was done, you look at it being good, bad, whatever it was still done. But there's some things that can be corrected, resolved, or made better. Now, basically all they're asking for is that the Annandale School's name be recognized in some way where the children come along. It has a historical base, still part of Pender County. It was the same as the C.L. Pope School that Mr. Pope had started, but during that same era, all the schools the names were converted and changed. The Black history part of it was left out. So Mr. George, I think, I don't know if the guy was a Hansley, one of the Hansleys.
I wasn't the only one who presented it to you. No.
You came and talked to
The superintendent.
superintendent and then gave me the packet, and then we shared it with all the board members. That's correct.
Yeah, people over there told me that they had presented to you.
And I've got an email with the petition in it, but I think we
Right.
all got it.
Yeah, we sent that out right after you came
That
out.
was the first you heard of it?
So this was back during the summer.
Okay.
I'll look it up right now.
What are the, Mr. Keith, if I can ask you a question, if you don't mind, you said that some recognition, do you mean like the renaming of the school? Do you mean, I know at one time I've seen where different parts of a building's been named, a gym, or what exactly do you, the group see as a vision for Annandale School?
What I would prefer doing is letting the guy that put petition together. If you've seen the petition, you've seen it's well written, well documented. I'm here because they asked me to bring it before the board and to give it some discussion. And I wouldn't want to jump in front of them. I'd be happy to have one or two of them contact you all, and I'll come before you and do it. I don't like to get in situations that's fussy because it can be done in a sensible way.
Well, when it happened with the CF Pope and we had that discussion, the group came and spoke to us that night, right? Were they at public comments, or was that on the actual agenda? They were on the agenda, correct? And that's what we need to do.
Yeah,
So
I spoke that night.
we could put that in for next month if you would.
Yeah,
Dr.
that'd be
Hill,
fine.
are you noting that? And then you could come back and talk to us absolutely about that.
Okay.
Because the packet that you brought and everything that we shared with everybody with the petition and everything, it was really well put together, had a lot of great history and all of that, so,
The email we got, and all the board members got it along with several community members, it looks like, was from Michael Garrison back on May 11th. So it was directed to all of us, it wasn't just.
Okay, that was before I got involved in it.
right, and then you came and, okay, that's right.
Yeah, Garrison, that is the fellow. Have you had any other communication with him?
I haven't, I don't know if the other board members did.
No,
No. Okay, let me do that then if you
you're
all put
actually
it
the
on the
only
agenda
one
for
that I
the.
think that spoke to you, right? Mr. Keith, that's right, so.
Yeah, they gave.
But we want to hear them. We want them to come back in November. Is that, you think that'll work? You'll let Dr. Hill know so we can get it put on the agenda and everything?
Oh, yeah, yeah.
That'd be perfect.
Works for me.
Thank you.
All right. Appreciate y'all.
All right, thank you. All right, with that being said, I think we can now move into the consent agenda. Board members haven't had time to review the consent agenda. Do we have a motion to approve as presented?
Madam Chair, I make a motion, we approve the consent agenda as presented.
All right, Mr. Smith has made the motion. Do we have a second?
I'll second.
Mr. George is seconded. All in favor say aye. Any opposed? All right, so carried. It does not look like we have anything for action agenda. Am I correct? Did I miss anything? So at this time, we're moving into item 10, comments from board members. Mr. George? Mr. Hall? Mr. Smith?
Thank you, Ms. Fontana. I wanted to take my moments for our comments to recognize an individual in Pender County Schools. Her name is Miss Joni Howe. She came to Pender County Schools as a nurse, but had over 15 years of teaching experience. Seeing the need of teaching positions to be filled, she expressed an interest to Heidi Trask High School to transfer into a position there. She immediately hit the ground running and implemented what we know now is called the Career Ready Simulated Workplace Classroom, where every student is assigned a job associated with a real job in the medical field. This week, the students at Heidi Trask and Ms. Howe's leadership have organized what they're calling a Pink Out Week. Every day, students have a dress-up day like homecoming, like a spirit day. They have different things. But this week is dedicated to honoring those survivors and remembering those close to us who we've lost to cancer. All proceeds that are collected there at Heidi Trask through her leadership will be donated directly to the St. Jude Hospital in Memphis, Tennessee. Tonight, the reason why I wear this pink jacket is in honor of what Miss Howe was doing there at Heidi Trask, and also to remember all of the victims, those who we lost with breast cancer, and those who are also survivors. And so we wanted to take a few moments, and I wanted to recognize during my portion of time Miss Howe and thank her and all the other dedicated teachers and staff we have in Pender County Schools. Thank you, Miss Howe, if you're listening.
Thank you, Mr. Smith. All right, and I have nothing at this time. Dr. Hill?
We do have a few things. One, we have our award. If you remember a few months, I don't know how many meetings back, but we have a representation. We were awarded the military, make sure I get it right, friendly district. So with Purple Star type award, this will be placed here in the Board of Ed chamber for you guys to enjoy, look at. We do love our military neighbors. Also, I wanted to talk a little bit about the initiative called School Stars. If you remember, Publix gave us a lot of kind of groceries gift cards. Those come from when you charge, if you go in there, you get points or whatever, you can sometimes say where they go, but they have so much community give back that they do. We just got lucky enough to be part of that program. So what we've established is kind of like catch somebody doing good, nominate someone. Anybody can nominate anybody that works in the system. And then every month we're going to award these people for what they're doing. To show you the impact of that, I think within 4 hours we had, 75 nominations, and they have to actually write it out. It's not just throw somebody's name in a hat. They actually have to explain why. And so that's just a little incentive to keep people, recognizing positive things that are going on, wonderful work that's happening in our system. And that leads right into, just want to give a kind of an introduction to what's coming next month. Pender Early College High School has been awarded the National Blue Ribbon Award. I don't know if everybody can understand the importance of that, and we will definitely, once the award is given, have a big opportunity here to bring it before the board. But preliminary, that's coming up early November. You have to be invited. I mean, this is big deal stuff. First one in Pender County. I don't know how to express that it's going to be such an honor. I mean, we'll go to DC, gather the award, go through a 2-day program, and they will bring it back, and obviously we'll have it here and we'll recognize them at the school. But I just want the board to understand there's only a handful of districts that get this in the nation. This is really a huge honor. And then some things that we started in the past, if you guys remember talking about pathways, and we started with mechatronics. Our staff has worked to get about a $250,000 Golden Leaf grant. Was it almost that? To buy some programs. We built some partnerships with Cape Fear that we've expanded on. We have some of our first graduates. So Carlos, our very first one, just by name, is Carlos Garcia Ramirez, actually graduated with an associate's in science and mechatronics engineering that started with us, and he has finished his degree. We've got 2 more right behind him with certificates already. So it's working, is what I'm saying. This is what we want to get. This is what we want to do. So these are great things that are going on in the system, and just worth the note and worth the saying that out loud. This is just things are clicking, and these kids are doing wonderful work. That's all I have now.
Thank you, Dr. Hill. At this time, board members, we need to enter into closed session. I need someone to make the motion, please. Does anyone have that written? Oh, there you go. Who would like to make, oh, there.
Pender County Board of Education will enter closed session subject to the advice from the attorney pursuant to North Carolina General Statute 143-31811A1 and A6 to prevent the disclosure of confidential personnel information under General Statute 115C-319 and to consider matters relating to initial employment of an individual employee. The board will also go into closed session pursuant to General Statute 143-31811A3 to consult with the board's attorney in order to preserve attorney-client privilege, to consider confidential student matters as provided in North Carolina General Statute 143-31811A1 and the Family Education Rights and Privacy 20 USCG 1232G and North Carolina General Statute 115C-402
This closed session is also necessary to consider and give instructions concerning lawsuits entitled Burns Fisher versus Pender County, State and Federal, and Pender County Board of Education versus Retirement System Division, Department of State Treasurer, Testers Board of Trustees.
All right, Mr. George has made the motion. Do we have a second? Mr. Hall is seconding. All in favor say aye. Aye. Any opposed? All right, this time we're now moving into closed session. Thank you, everyone. reconvening at this time. At this time, board members, we need to make a motion to approve the Human Resources Report and Addendum as presented.
I will make a motion that we approve the HR report and addendum as presented.
Mr. Hall has made the motion. Do we have a second?
I'll second.
Mr. George is seconding. All in favor, say aye.
Aye.
Any opposed? So carried. At this time, we need a motion to adjourn.
Make a motion to adjourn the meeting.
Mr. Smith has made the motion. Do we have a second?
Second.
Mr. George is seconding. All in favor, say aye.
Aye.
Any opposed? Okay. We are now adjourned. Thank you, ladies and gentlemen.